opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency. We're servicing Palm Beach County, Broward, and Miami-Dade. You can reach us directly at 954-717-7027. I am your host, Louise Gomez. Welcome to the show, everybody. And I would like to introduce everybody to Dr. Manjaree Daw, who is a PCP right here in Cleveland Clinic in Martin Health. The address is 1095 Northwest Port St. Lucie West Boulevard, and the zip is 34986. And you can reach her directly at 772-288-5862. Welcome to the show, Dr. Daw. How are you?
I'm great. Thank you for having me.
Thank you so much for taking time and out of your busy schedule and letting us talk to you and learn about all that you do. And when I saw the subject of longevity, that's like my favorite. I love to talk about longevity. So let's start off a little bit about your background and, maybe where did you go to school? What made you want to become an internist and lifestyle medicine doctor?
So I was born, raised, and educated in India.
Lovely.
And after med school, I did a couple of years of postgraduate training in England. And then I came to the United States. I like to say I got off the boat in Connecticut and sort of stayed there. I did my residency and chief residency in Connecticut at a Yale New Haven affiliated hospital.
Wonderful.
And I spent most of my working life as a primary care physician so far in Connecticut. 2 years ago, we came to sunny Florida, and here I am with Cleveland Clinic. And primary care is what I've always done.
Nice.
During and towards the late end of COVID, I became more interested in lifestyle changes that can help mitigate, chronic diseases and help prevent them, sometimes treat them, or even reverse them. So I got a second board certification in lifestyle medicine.
I love that.
Here I am.
That's wonderful. We interviewed another doctor a couple weeks back from Yale, so they must be doing some good recruiting over there and grabbing the best of everyone. So
Yes.
That's amazing. So, Dr. Daw, I did have a question about, life expectancy. Everybody, wants to think, my parents or my grandparents lived till this age and this is my destiny. How true is that? Or can you clarify and give us maybe some more information about life expectancy and inheritance?
Absolutely. So life expectancy is partly inherited. Studies show that the numbers can be somewhere between 10 to 40% actually. But that is only part of the story. There's a lot more to it. It's it's more complicated than just your genetic predisposition. So, people who have uncles and aunts or brothers and sisters who live to a ripe old age will more than likely live to a ripe old age and not suffer from the diseases of aging, such as, high blood pressure and so on and so forth, or they will suffer it much later on in life.
Mm-hmm.
However, studies done on identical twins who were separated at birth and raised under very different circumstances have completely different life expectancies. So you could have twins born to a family of
Wow.
people who have longevity, and then one is raised by a family with healthy lifestyles and the other not. And the second one actually doesn't live a long and healthy life. So, genetics is not the be all and end all of longevity. It's lifestyle interacting with genetics that
Yes. Yes. So
predicts
interesting.
what's going to happen to us.
So interesting. I know that I don't know if people have heard of Wim Hof, but he actually has a twin brother. And then Wim Hof has taken this whole lifestyle and breath work and movement and exercise to a whole new level, and I don't think his brother has. So I think what you're saying makes so much sense because lifestyle has so much to do with it. And even, meditation and the ability to reduce ourselves of stress. How important does reducing ourselves of stress play as far as play into our lifestyle and
So
health?
important. Very, very, very important. So, modern life, modern American life in particular, is stressful. And
Yeah.
I always tell my patients, you have very little control over what life throws at you, but you can have a lot of control over how you react to it, right?
Yes.
So stress reduction, starting with, of course, mitigating circumstances that are causing you stress. And if you can, try not to have those circumstances in your life. But if you can't, then make
Sure.
sure you get enough sleep. Make sure you know how to problem solve amicably. Have some practices such as breath work that you mentioned,
Yeah.
meditation, just going for a walk. And when I tell people to go for a walk, I tell them go out there, like walk in nature. That's better
Yes.
than walking on a treadmill always. So stress reduction, because stress causes the release of hormones and chemicals in our body that predispose us to heart disease, strokes, diabetes, gaining weight, and a whole bunch of other bad stuff.
Mhm. Yeah, it's interesting because I know, like in other countries, my brother lives in Japan, for example, and they just recommend forest bathing. They call
Yes,
it
the
just,
doctor actually gives you prescriptions for forest
yes,
bathing. So glad you brought it up. Yes.
yes, forest bathing in Japan. So, like, yeah, they'll give them a prescription, like go into nature, and it's
Mm.
amazing for me. I can remember so many times in my life where I had very stressful episodes in my life, and it just instinctively wanted to walk in nature on a trail and a path. And it really, I can honestly say, it makes a big difference. It really makes a huge difference.
And we are in modern life very nature deprived, so we have to make a very special extra effort to get back with the trees and the plants and the animals around us.
That's so true. That is so true. So, how can we start making a difference in staying healthy longer?
So I think our listeners who are listening to this, or hopefully will listen to this, are already halfway there, right? They're
Yes,
interested.
yes. Everybody is
And
interested for sure.
yes, correct. So we are already halfway there. Some small changes: um, eat healthy,
Yes.
move a little, sleep well,
Yep.
manage stress well, have friends. And when I say friends, I mean meaningful friendships and social connections, not the
Yes.
friends for Instagram posts, which
Right.
actually cause you more stress,
Right.
but the friend that you would
Yes.
call if your cat died.
Yeah.
Yeah. So, yeah, that kind of stuff.
So I'm glad you mentioned all these different domains because having watched many different episodes or just things about the blue zones, quote unquote,
Yeah.
and so many different factors that you just recommended. Good sleep hygiene, obviously healthy food, exercise, but community, like having that real connection to a community is such an imperative factor that can maybe easily be overlooked.
Yes.
So
Absolutely.
I really think it's important that people get that connection to whatever their community is, whether it's an exercise group or right maybe a church, whatever it is. But it's just those little things all added up really do create the difference, right?
Absolutely. And you mentioned community also. In a community or in any setting, actually, doing something selflessly for others that
Yes.
makes you feel better, that actually mediates stress, releases hormones that make you happy and healthy and live longer. So
Right.
selflessly doing something for someone else, you know.
Yes. Yes. Very true. And then some people say having animals. I don't particularly have an animal. I've had in the past, but I know that that definitely is another factor, right? And
Yes,
yeah,
yes.
yeah.
Petting animals, holding a baby,
Uh huh.
laughing, all these things do help.
Back to basics, right, Dr. Daw? This is all the stuff that our grandparents were doing, and
Yes. I'm
uh,
glad you brought up grandparents, because I tell people, if you go to the supermarket and pick up some food that your grandparents wouldn't recognize when they were young, you
yeah,
probably wouldn't be eating it.
that's a really good point. I do want to dive into a little bit more about healthy eating. I know I really try my best to stay in the perimeter, like they say, right? Let's stay in the
Right.
perimeter with the fruits and vegetables and all that. What would you say? I know everybody has a different lifestyle as far as diet, but is there anything that you can recommend as far as diet?
So I'm going to start with a quote from one of my favorite authors, Michael Pollan. And he says, eat food, not too much, mostly plants. So that's where I'm going to start,
I
you
love
know.
that.
So portion control,
Yes,
eating a primarily plant-based diet. I'm not saying you cannot have
sure.
animal protein, but primarily plant-based diet. And actually, that improves longevity up to 10 years from what I remember. And the biggest offenders in cutting short your life is actually red meat and processed
Yes,
foods, and processed meats in particular. Um,
sure. Dr. Daw,
um,
I just gave up coffee. I've been a coffee drinker for maybe, I don't know, 35, 40 years, let's say. But I noticed that it was time certain things had been affecting me. And it's been almost 10 days, and I noticed a difference. I noticed a difference. What can you say to our coffee drinkers?
so I gave up coffee about 2 months ago, because I
Oh,
think
okay.
and I drink only tea now, and I feel a lot better because I feel like I've been freed from dependence on caffeine, and that was the reason I couldn't stop at a cup.
Yes.
But I will say that some coffee is actually good for you if you can control the amount of coffee that you drink. One to
Okay.
two coffee are associated with a lot of health benefits.
Okay.
So if you love coffee, you can drink it, but just don't drink too much, because it raises your blood pressure and makes your
Right.
heart race. So you shouldn't get into that cycle where you feel like you can't function if you don't drink one more cup of coffee.
I like the way you said you broke your dependence from it because that is liberating.
Yes, because, again, Michael Pollan, he calls coffee the world's most legalized and commonly used drug, because, the way it affects your brain chemistry, you just want more and more and more of
Yes.
it. But despite that, caffeine actually is good for you. And again, not me, someone was asked,
Sure.
how should you drink your coffee? What's the best way to drink coffee? And he said, with your friends. And I love that answer.
I do too. I do. I love that. I know there's so much information about coffee lately. Now they're saying you have to be careful. Some tested for mold. You have to have a certain brand or whatever. So, yeah, there's just a
I
lot
think
of.
sometimes there is so much information out there that we get lost in the weeds, and not all of it is
Sure.
science based, or not all of it matters. Like, for example, this whole thing about organic food. And we should try and eat organic food.
Right.
But if we can't afford organic food, we should be eating inorganic fruits and vegetables. We should be eating fruits and vegetables rather than a burger.
Right.
Do you know what?
Sure.
Yeah.
Yeah.
Yeah. And we live in Florida. We have a wealth of fresh fruits and vegetables. So we should eat what's grown close to home. Um,
Yes.
you know.
Yes,
So
agreed.
I
We do have a lot of farmers markets just popping up everywhere. So supporting that local community with the fresh, vegetables and fruits from the local. I like you said, living in Florida, we do have that opportunity.
yeah.
Yeah, it's important for sure. So let's talk a little bit now about people hear the word exercise, and some people, they hear that word. Well, actually, we have a quick commercial break. When we come back, let's talk about exercise. All right, we'll be right back. Thanks.
Absolutely.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to You and Your Doctor. We are having a wonderful conversation with Dr. Manjaree Daw, who is a primary care physician right here at Cleveland Clinic, Martin Health. The address is 1095 Northwest Port St. Lucie Boulevard. The zip is 34986, and you can reach her directly, 772-288-5862 for an appointment. And we are talking lifestyle medicine. We're talking longevity. We're talking all the things that apply to all of us, no matter where we are in our life, right? I think it's never too late, right? But we were talking about exercise, Dr. Daw. Let's delve into that.
Let's delve into that. Again, our audience is already halfway there. They're listening to this show. So exercise is very, very important. And I know a lot of people get overwhelmed by the fact that I haven't exercised in a while. What do I do? Do I need a new pair of sneakers? Do I need a gym membership? It's so hard. I'll do it on Monday. I'll do it after my birthday. I'll do it after my Thanksgiving. I tell people, just jump right in where you are. You don't need anything fancy. Start small, but remember, it has to be consistent, right? Maybe start with a 5-minute walk after lunch and dinner, and then slowly work it up to 15 minutes so that you can get a 30-minute walk. If you like to go to the gym, go to the gym. If you really don't like the idea of walking, do something that you enjoy. If you like dancing, go dancing. If you like swimming, swim. Play basketball with your kids. Hang from the monkey bars with your grandkids in the park. Do something. And then, think of exercise as movement, right? Not just formal exercise. If you call your mom once a day, don't sit on the couch and call her. Walk around and talk to her.
Right. Create a new habit.
Build a new habit. If you can take the stairs instead of taking an elevator. If you sit on a chair all day and do meetings, stand up sometimes. If you like a TV show after dinner, put it on, but don't sit. Maybe stand behind the couch and march in place. There's
Right.
lots of ways to move. Just move and just do it, like the Nike ad says.
Right. I like how
But
you I like how you correlated fun to it. Hang off the monkey bars or dance, or
absolutely,
it doesn't
you know,
always have to be so serious.
and children, and again, nowadays children don't go out and play that much, but when children went out and played, they didn't think that they were exercising, right? They were just
Right.
running around wild outside, and they
Yep.
got all the activity that they needed to do.
Yeah.
um,
So true. I recently got gifted a little rebounder, those little mini
I'm
trampolines.
so glad. Please jump on a trampoline. I forgot to mention that. Rebound
I'm
on it. It's
I'm
so much.
having the best time. I'm
Oh,
doing
that's
that like cuz
wonderful.
yeah, so like I work from home, so several times during the day I'm like I get to take my break. I'll take my 10-minute bounce for 10 minutes, put the music on, and then go back
Absolutely.
in.
And it's so good for your bone health.
Oh,
It's very, very good for, so you build bones. So,
I didn't know
women,
that.
yeah,
Oh,
women lose bone and it starts accelerating after menopause, but men lose it too. They just lose it a little bit later in life, and you lose bone mass, and you don't feel ill or you don't have aches and pains from that, but it makes you more likely to get a fracture with
oh,
minor trauma. So, walking's great too, but
sure.
rebounding's wonderful to build back bones.
Yeah, I heard it was also good for that lymphatic drainage.
Lymphatic drainage, yes.
Okay,
Yes, it's
good.
just plain fun.
Right. What about I do hear a lot as we age, especially women, we lose that bone density after menopause. What about I hear a lot of people talking about, resistance training. I mean, I'm not talking major weights, but can you speak into the resistance training and
Yes,
how is that
yes. So
important?
I would recommend resistance training for everyone as they're aging, because an inevitable part of aging is losing muscle mass, right? So
Yeah.
just freehand weights at home, a few resistant bands. You can put on I mean, YouTube has hundreds of really good programs where you can do that. So very important to maintain muscle mass.
Yeah.
That helps you with your balance, that prevents falls. So pliability of your muscles is very, very important.
Sure, sure. I wanted to ask you, Dr. Daw, there still are some people that are smoking and vaping. What can we talk about? How can we address that and raise awareness? I mean, we all know it's a habit, but what can we say to people who are wanting to quit?
Please stop now.
Yeah,
There are many ways to do it, but please, if it's probably one of the best things you will do for your health.
yeah,
It is one of the most toxic substances that we can expose our bodies to. There is a component to it where you become addicted to nicotine. So it's not everybody can just go cold turkey and stop. So you need
sure.
help. Maybe you need a medication to help you quit. Talk to your doctor, but stop smoking. And
Yeah.
actually, the benefits are almost immediate. I think if you stop smoking today, within a year, you cut down your risk of heart disease by 50%.
Wow.
In about 2 to 3 years, you cut down your risk of stroke. In
Yeah.
about 10 years, your risk of cancer goes down and you're almost like a non smoker. It doesn't go away completely, but it's much reduced. I mean, smoking, high blood pressure, COPD, stroke, about
Yeah.
12 kinds of cancers are associated with smoking. And
Yeah.
one in every 5 deaths today in America is from a smoking related illness. So it's a terrible
Wow.
thing. Stop
Wow.
smoking, and that includes vaping too.
Yeah, I think vaping is, from what I hear, all the chemicals in that vaping device,
Correct.
it's just awful. Yeah.
Correct. So it's the actual thing that you vape is dissolved in an oil medium, and
Right.
that medium literally corrodes the
Sure.
all the parts of your lungs. So it's very bad for you. So please
Sure.
stop.
Yeah, definitely. Yeah, so what can somebody expect when, they go to see you and they have a visit? What would that look like?
So it would depend on what the visit was for. But I'm assuming they would come in as a new patient, so it
Yes.
would include an overall health assessment that would try to. So first of all, I would try to get a sense of who they are as a person,
Nice.
not just what their medical conditions are, because
Right.
health is a 360-degree thing, right?
Absolutely. Yeah.
And I try not to talk at people and try to fix them.
Nice. Yeah.
I want them to be a partner as this. I want them to feel empowered. I want them to feel like they want to partner. I'm just the
Yes.
catalyst.
I like
They
that.
should be doers,
I like that.
So that healthy lifestyle, if you have diseases that need medications, we do medications, but we use them judiciously. We don't use them if we don't have to. If we can control your
Sure.
diseases or remove them with lifestyle, I would rather do that. But that's not always possible, and we also have to be realistic. I want them to have I want to have a relationship with them where they could
Nice.
feel comfortable, that they're not scared to come in.
Sure.
I'm not to scold them. I want them to be well. I want them to live long, be happy, and be healthy. But I don't want to do it for them. I want to do it with
I like
them.
that. I like that.
Sense.
Dr. Daw, this time has flown by so fast. It was such an enjoyable conversation with you. We really need more doctors like you who are really focusing on the lifestyle changes that we can also participate in and be empowered by our medical professions. So thank you for shining your torch and shining the light on us, and we will hopefully have another interview with you in the future. And thank you again so much. I'm going to give your number out before we go. It's 772.
Thank you so much. It's been a pleasure for me as well. And like I said, just do it.
Thank you. Love it. 772-288-5862. Thank you. Great night.
Thank you.
Bye.
Bye-bye.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-54